Ever wondered why mastering BiPAP machine settings is so crucial? Today, we're diving into this intricate topic. Whether you're a seasoned user or just starting your journey with BiPAP therapy, getting to grips with the settings can significantly improve your sleep quality and overall experience. Firstly, let's clarify what BiPAP therapy is all about. BiPAP, or bilevel positive airway pressure, is a non-invasive form of therapy widely used to treat conditions such as sleep apnea and COPD, among other respiratory disorders. Unlike its cousin CPAP, which delivers constant pressure, BiPAP provides two distinct levels of pressure: inspiratory positive airway pressure, or IPAP, and expiratory positive airway pressure, or EPAP. Scene script: IPAP is the pressure delivered when you inhale, and EPAP is the pressure during exhalation. These twin forces work in tandem to keep your airways open, preventing apneas and hypopneas. Typically, IPAP is set higher than EPAP, creating a pressure gradient that helps to overcome any airway resistance. The key to effective BiPAP therapy lies in fine-tuning these IPAP and EPAP settings to suit your unique needs. Your healthcare provider will initially prescribe starting pressures based on your sleep study results and clinical assessment. However, these settings may need tweaking over time to ensure you're getting the most from your therapy. Many BiPAP machines feature a ramp function, which gradually increases the pressure from a lower setting to your prescribed IPAP and EPAP levels over a certain period. This function is especially helpful for those who find sudden high pressures hard to tolerate when starting therapy or when transitioning from exhaling to inhaling. Pressure support, the difference between the IPAP and EPAP levels, provides an extra push of pressure during inhalation to assist with breathing efforts. Adjusting the pressure support can help alleviate any breathing discomfort and improve ventilation efficiency. Some BiPAP machines offer different modes of operation, such as spontaneous timed, ST, spontaneous, S, and timed, T. These modes dictate how the machine responds to your breathing patterns. The spontaneous mode syncs with your natural breathing, while the timed mode delivers breaths at a fixed rate, irrespective of your respiratory effort. Your healthcare provider will determine the most appropriate mode based on your condition and treatment goals. Lastly, don't overlook the humidification and temperature settings. Dry air can cause discomfort and irritation to the airways during BiPAP therapy. Using the humidification feature and adjusting the temperature settings can help alleviate these symptoms, promoting greater comfort and compliance with therapy. In conclusion, mastering BiPAP machine settings is a must for optimizing therapy effectiveness and enhancing comfort during sleep. By understanding and adjusting settings like IPAP, EPAP, pressure support, mode selection, and humidification, you can tailor your therapy to suit your individual needs and preferences. Always consult with your healthcare provider for personalized guidance and adjustments to ensure the best outcomes. Thank you for joining us today, and until next time, sleep easy and breathe easy.